All right. Thanks for being here today.
I'm happy to do this.
Yeah, I'm super excited to chat.
We go back a long way from Queensway Carleton Hospital days to helping out with the longevity clinic now, and we've had a great relationship so far. So it only makes sense that we get together and do this.
Absolutely. Super excited about this talk. So Andy, why don't we start by just tell me a little bit about you and your background, and maybe a little bit of background of you and I working together, and then we can jump into it.
Absolutely. So my designation is a registered polysomnographic technologist, which is really a mouthful for a sleep technologist. I went to school for sleep medicine technology, spent my first 10 years or so working straight overnights in sleep labs, doing diagnostic and therapeutic sleep studies, and then was able to get the role of senior of cardiopulmonary at the Queensway Carleton Hospital, which is where I met you. You came in there along with a few of the other cardiologists in the city, and anything to test with the head, the heart, or the lungs, we did it at the QCH. And our journey, I guess, started there. And from there, I kind of evolved my designation to a lot more than what it was once intended to be. You know, the sleep technologists were meant to sit in the dark, sit in a sleep lab, and, not really see any daylight. The irony there of, some of the worst sleepers in the world are the ones that are working in the sleep lab. So I started sleep efficiency in 2015. To fast forward today, corporate sleep consultant, working with large organizations, working with some sports groups. And of course, we have our business model, which is home-based sleep testing, which helps services more than 200 physicians in your clinic longevity as well.
Awesome. Yeah, thank you. And as you know, we started the cardiac longevity clinic, mostly focused on improving not just sleep, which you are helping us with, but also overall kind of a lifestyle modification, kind of looking at fitness assessment and exercise, sleep, mental health, nutrition, and then combining that with cardiovascular assessment and metabolic assessment, really to give people a very full picture of their health as it pertains to longevity and cardiovascular health. So today we're going to talk about sleep and how it relates to cardiovascular health. So super important, right? I mean, we all know anecdotally how important sleep is. If you're not, it's our superpower, right? Like if you're not sleeping properly, you're not able to function. It affects your performance. But we're also going to delve a little bit deeper today and talk about how it actually affects your health, even below the facade of our performance on a day-to-day basis. It really affects our health within our body, within our physiology, and kind of we delve into just heart, but also overall body. I just want to give a couple of quick statistics because I think these are, and feel free to add to some of these, 1 hour sleep deficit increases your risk of heart attack by 24%. So pretty crazy. For people who sleep less than 6 hours a night, they are twice more likely to have a heart attack, which is pretty crazy. With regards to longevity, people who have chronic sleep deprivation, they have 26% higher risk of mortality compared to people who are sleeping 7 to 8 hours.
It's wild.
Right?
Yeah.
So
tell
me about that.
There's the global phenomenon of daylight savings times that's always in, the front of the news, whether we should abolish it, whether we should keep it. That one change, that one loss of hour that you were speaking to beforehand has known to increase motor vehicle accidents, heart attack and stroke. And these people that are already susceptible to cardiac disease, we see the increase the following day in that 24-hour period following that time change. And then conversely, when we gain the hour back, we see the opposite. So again, when we lose that hour, we're seeing more increase of motor vehicle accidents. We're seeing medical errors that are occurring, and just your overall health suffers dramatically. So such an incredible piece to make sure that we prioritize it. And that sweet spot now is to get somewhere between 7 to 9 hours is what they're saying. And again, you can't really pay it back on the weekends. It's something that you need to prioritize night after night after night. It's responsible for our physical, mental, and emotional health.
Yeah, so let's talk a little bit before we delve into brain health. Let's talk a little bit about actually the brain function, emotional health. So tell me a little bit about that. How does sleep affect brain function?
So we've spoken a few times on different places that I've been to, whether it's the news or I've talked to other large organizations and groups, podcasts, on the importance of sleep cycles and what that actually does. When we go to sleep at night, our body passes through sleep cycles, which are 90 minutes in duration. And prior to late 50s, there wasn't really a lot known to what's going on. Only in recent times did we discover that, the brain activity that's occurring throughout the course of the night, the shape of the brainwave is changing, the frequency of the brainwave is changing, the overall look. And we developed the sleep cycle that was born out of it, which are 90 minutes in duration, where we go from light stages of sleep to deep stages of sleep, and then we close out with a REM period, which is our dream sleep. And every one of those stages afford a different symptomatic improvement. Our deep sleep, or our slow wave sleep, is responsible for that physical restoration. It's also when our blood pressure drops and when our heart rate decreases as well. So it's almost, when you go into your deep slow wave sleep, it almost puts like a force field around your heart so it can rest and recover. And we see a lot of patients that you're referring with new diagnosis of high blood pressure. So what they're looking to do, and what I suspect you're referring for here, is like, do we really have a high blood pressure issue? Or could sleep apnea be exacerbating the situation, the underlying kind of condition? So our slow wave sleep, critical for our physical restoration, but also lowering heart rate and blood pressure. Our REM sleep, or our dream sleep, is responsible for our cognitive restoration, our mental horsepower, our basic. What's happening with our REM sleep is we're able to take things that we've learned earlier in the week and actually encode them so that we're able to retrieve them at a later time. Memory consolidation is a massive piece of our REM sleep. So for your physical cognitive performance, which typically occurs towards the later hours of the night. So the first portion of the night, even though you're going through sleep cycles, which are 90 minutes in duration, the first part of the night is mostly taken up by slow wave sleep for that physical restoration, and then the cognitive regeneration is through the back half.
Awesome. Yeah. So, you kind of pointed out, right, of the importance of how it affects REM, really affecting kind of the emotional health, emotional restoration, and then deep sleep really having all of these physiological recovery functions, right? And being super, we see that all the time in the longevity clinic with regards to how sleep is foundational to cardiovascular health. And you and I, when we were at the Queensway, we had a lot of times these patients, when I would refer to you, with a whole bunch of cardiovascular illnesses, right? That could be related to essentially sleep disorder breathing, particularly sleep apnea, and general poor sleep. So let's start by first talking about, before we get into sleep apnea, let's talk a little bit about poor sleep and how just sleep deprivation can affect your health. So can you give me some examples of how sleep deprivation would affect health?
We used to wear the no sleep badge of honor on our sleeve, right? The person that pulled the all-nighter was the hero in the workplace. Now we've fast forwarded to today, where we can actually find out that if the person had just gotten the recommended 7 or 8 hours, they would have been a lot more productive. But our overall health is impacted on a daily basis, whether it's that physical, mental, emotional health that's taking place with continuous. When you're completely underslept, whether it's 5-6 hours, I believe that you probably know the stats better than I do. I think it's about a 40% increase in high blood pressure in these types of people. So constant sleep deprivation and sleep disorders play a profound role in cardiovascular health. And I think it's something that we need to really start to address. A lot of times when we get referrals coming in from cardiology clinics or from just doctors around, the family physicians are programmed to kind of ask a variety of different questions, but nobody's really asking about their sleep. And other than taking, maybe standard blood pressure tests, I don't really know how many of the family physicians are actually doing a deeper dive into the cardiovascular health. And again, sleep is kind of a spoke in that cardiovascular wheel. I'd defer to you on that. Where do you think the family physicians are at with regards to promoting cardiovascular health?
Yeah, so I think one of the main problems, as you said, is kind of lack of awareness, right? Like a lot of times family doctors don't even necessarily think about sleep being a foundational issue that could affect their patients. I see this in my cardiology clinic and in my longevity clinic all the time. Patient comes in, they have, for example, elevated blood pressure, or that is difficult to control. Multiple antihypertensives can't control the blood pressure. When you actually delve into it, the problem is actually their sleep. They're not sleeping properly. Or the other common referral that I get is fatigue. Overall fatigue. The family doctor is wondering whether it's a cardiac condition causing the fatigue. You quickly delve into it. Within a 5-minute conversation with the patient, you realize the problem is actually insomnia or sleep disorder breathing that is causing that. And I think fundamentally the physiology of it is important. So maybe we can talk a little bit about the physiology of how does poor sleep and how does sleep apnea actually cause these issues like high blood pressure, for example. So let's focus on high blood pressure now that we're talking about that.
Sure. And I'll lead up by just like the sleep apnea piece and how it's such a culprit. I think our stats are now 1 in 4 people have sleep apnea or are at the risk of having sleep apnea, and 80% of the population is still undiagnosed. So what's happening, these are muscle tissues in the upper airway that cause partial or complete blocks. When that happens, it causes your oxygen levels to go down, your carbon goes up, so your brain sends a signal to breathe, to start breathing again. And it's basically calculated on what they call an AHI, or an apnea-hypopnea index. And they can be obstructive apneas where they're complete pauses, up to 60 seconds, 90 seconds even. And the frequency, they can be happening, up to 100 times per night. It's broken down into mild, moderate, and severe, and it's based on how many breathing events they have on that hourly basis. So anything between 5 to 15 events per hour would be mild. Anything between 15 to 30 events per hour would be moderate. And then anything over 30 events per hour would be severe. So if you can imagine, when we have these long pauses, and as you already know, but for the people that are listening out there, the strain on the heart when this is occurring, those oxygen desaturations, they should be maintained above 90%, typically 95, 96, 97, depending on your age, of course, and any other comorbidities. But ultimately, they should be maintained above 90%. And when you have these repeated pauses, oxygen levels are going down. And in many cases, it's like your heart can be running a marathon when it should be resting or recovering every night. Sometimes they'll take a couple quick recovery breaths, but then the apnea happens again because that apnea-hypopnea index can be, as I mentioned, 70, 80, 90 times an hour. So these people are completely broken in many senses of the word. And it's not just whether it's leading to blood pressure, high blood pressure, a lot of it can be a lot of daytime fatigue. These people have what they call very high excessive daytime sleepiness. So, they're falling asleep at work, they're falling asleep, poor memory and concentration. All of these different things are all attributed to sleep apnea. And, the therapy needs to be in place really quickly. A lot of heart failure patients, as I'm sure when you were working at a heart institute, many of those people that suffer from heart failure were because maybe it was not even undiagnosed, but definitely untreated sleep apnea, whether that's obstructive sleep apnea or central sleep apnea. The difference between the two, obstructive sleep apnea, the respiratory drive is still there. The body's still trying to breathe. Central sleep apnea, the respiratory drive is taken out completely. The obstruction is still happening in the upper airway. So again, constant sleep deprivation can influx a variety of different things. It can have such a negative impact on your cardiovascular health. I'd actually like you to expand on that and teach me a few things, but more about cardiovascular health as well and the impact as it has on sleep. Because, while there are 100 different types of sleep disorders, I know a little bit about all of them and a lot about most of them, but we realize that there's new areas of study that it's impacting, from, diabetes to insulin resistance. So yeah, I'd kind of pass the mic back over to you and expand a little bit further on how what you've seen in your career so far regarding whether it's a heart failure or the correlation between arrhythmias, and go for that.
Yeah, so it's interesting that you look at it, because you're a sleep specialist. You look at it from the airway standpoint.
Mm-hmm.
Being cardiologist, you look at it all from kind of a metabolic standpoint, right?
Mm-hmm.
Because that's really how we look at things with regards to cardiovascular health. So I would kind of break it down essentially to kind of a sympathetic versus parasympathetic nervous system, right? So when you're getting good quality sleep with lots of deep sleep, your parasympathetic nervous system is basically on. And your parasympathetic nervous system is really your rest, relax, and recovery system, right? Mm-hmm. So when your parasympathetic nervous system is super activated during the deep sleep, that means your heart rate drops, your blood pressure drops, your cortisol levels go down. And cortisol is a very, very important hormone when it comes to your metabolic health and your cardiovascular health. It is essentially your fight and flight hormone in your body. It is when you're stressed, when you're sleep deprived, your cortisol goes through the roof, and it has significant adverse effects on your cardiovascular system and on your metabolic system. So the reason that people with sleep apnea, one of the reasons that they are struggling with hypertension or with conditions like atrial fibrillation, which is an abnormal electrical activity in the heart, and even heart failure, and to some extent heart attack and stroke, is really this elevated cortisol levels chronically, which do not come down during the deep sleep as they normally should. So this imbalance between your sympathetic and parasympathetic nervous system, that's driving basically stress on your heart, stress on the walls of your arteries, causing damage directly to the lining of the arteries that then lead to plaque formation, which is what we call atherosclerosis. And ultimately, plaque is how you develop heart attack and stroke.
Mm-hmm. It's very interesting. Yeah. I'm learning lots today myself. Yeah, it's great.
Yeah. So you kind of talked a little bit about atrial fibrillation, and you talked a little bit about heart failure. We talked a little bit about the heart attack and stroke. Now, what about lifestyle? So let's say somebody comes and see you or see me. Let's say they have kind of mild sleep apnea or they have moderate sleep apnea. Certainly with moderate sleep apnea, and you can kind of comment on that a little bit, we usually start to recommend therapy. But let's say somebody has mild sleep apnea, so they're going in the wrong direction. So first, let's a little bit talk about how does lifestyle affect sleep and vice versa, and what are some of the things that people can do to lifestyle-wise to improve potentially their sleep apnea?
Good question and comments. Ultimately, as soon as your feet hit the floor in the morning, what you do throughout the course of the day is going to impact how well you sleep at nighttime. Doesn't happen. Good rest doesn't start when you go to bed at night. It literally happens at the beginning of the morning. So first thing, we've talked about sleep hygiene techniques, which is essentially best sleep practices. First thing you can do when your feet hit the floor in the morning, exposing yourself to as much natural light as you possibly can. Light enters the eye via the retina, which sends signals to your suprachiasmatic nucleus, which then activates different systems in your body, and it signals other systems to sort of wake up, and it brings balance to your circadian rhythm, which is your body's 24 sleep-wake cycle. So I would say, your first hit right out the gate, exposing yourself to as much light as you possibly can is a great takeaway. And then the opposite of that, if we want to talk about exposure to light quickly, is reducing the amount of light that we receive in the evening, artificial light, blue light. This has been known to suppress melatonin, which is our sleep-inducing hormone. So, general rule of thumb, we'd say 2 hours before bed, kind of go old school, if you will, switch off all the lights in the house or at least dim them out. We live in a world now where our phone is in our pocket and we're bringing it to bed with us. And, there's different filters that you can put on your phones now and these types of things, but ultimately getting the electronics out of the bedroom and keeping your bed is somewhat of a sleep sanctuary and a place where when you go there, you're only there to do one thing, was essentially sleep. So that's kind of the first kind of quick hits for your exposure to light as much as you possibly can in the morning, and then reducing that in the afternoon or in the evening rather. Excuse me. I would probably watch your caffeine intake as well. Caffeine has a half-life of about 5 hours. So, some people are drinking coffee till 4 or 5 o'clock in the afternoon. Sometimes people are having it after dinner. So 50% of that caffeine is going to be in your system 5 hours later, which is going to impact what we call your sleep onset latency. That's how quickly you fall asleep in the evening. So talking about insomnia is defined as the inability to fall asleep, but also the inability to stay asleep as well. So, caffeine intake would be, nothing after 2 o'clock in the afternoon would be a quick hit there as well. Alcohol consumption would be another one. As I mentioned, it's a variety of best sleep practices that you can do that are stitched together that ultimately give us a quality sleep at night. From an alcohol perspective, we've referred it to the nightcap many times. It's something you have right before you go to bed, but it can have detrimental effects on your overall sleep quality. When it metabolizes, as you would already know, but again, for listeners, it turns into a sugar, which creates arousals throughout the course of the night. It also suppresses your REM sleep. So you kind of wake up in a fog in the morning. You've deprived yourself of all that REM sleep throughout the course of the night, which is essentially what's responsible for that cognitive restoration. So, I'm not saying to cut out alcohol altogether, although it's probably not a bad idea these days. A lot more research showing that it's not great for us, even 1 or 2 drinks. But if you were to, have a glass of wine, I'd probably keep it earlier in the day so it has a chance to metabolize. Because all of these things, again, are going to put you in your best case scenario for sleeping that night. Another quick hit would be, your exercise. And maybe you can add on that just because as it pertains to, cardiovascular health. But many studies have now shown the more exercise, the more vigorous exercise you get, the deeper sleep you go into, and you'll stay, and you stay in that slow wave sleep, which is responsible for that quality of physical restoration, which is when our blood pressure drops and our heart rate goes to its lowest point. So if you've done a lot of physical, vigorous activity throughout the daytime, your body's going to get into that deep sleep. You're obviously going to be able to fall asleep a lot faster, but you're going to get into that slow wave sleep that's going to afford all of those improvements that you're looking to do. So, and if you can get exercising outside, then you've kind of got a win-win kind of thing there. But I'd maybe ask you to expand on that, on the importance of exercise, because everything, we're kind of batting the ball back and forth here, and everything is so integrated with each other.
Yeah.
You can go spin off, and there should be a nutritionist here, and it's and I know you've got that longevity. So I'll pass it over to you and what you think.
Yeah, so I think definitely the connection between exercise, and I think that will kind of segue us nicely into the lifestyle piece, right? So it's almost like a positive feedback loop with exercise, right? Because when you exercise, particularly if it's outside, you're getting some sun in your eyes, it definitely makes you sleep a lot better quality sleep. Both your sleep efficiency goes up and you get more deep sleep, generally speaking. And as a result of that, then you recover a lot better. And then you have more energy next day to exercise more. So it's almost like this cyclical cycle, right? Like you're more active, you sleep better, and it kind of goes around and around. And it also affects your nutrition. As you kind of pointed out, it'd be nice to have a dietitian here because, and there's lots of data on this actually. I was looking at this crazy data that people who have chronic sleep deprivation on average, they consume 300 calories per day more compared to people who sleep well.
Yeah.
Right?
Yeah.
Just making bad food choices, foods that are usually high in fat and high sugar. And we've all experienced that, right? Like if you're coming up, I mean, you used to do night shifts. I used to do night shifts. And just coming off of one of those night shifts, you just have this, there's just the inclination towards junk food, right? So massive effect on diet as well and weight gain.
To expand a little bit on that, if you're staying up later at night, when you probably should be sleeping and prioritizing that, right? You're shortchanging yourself with sleep, and that's when you're going for those extra snacks when you really don't need it. It affects your leptin and your ghrelin, right? What controls appetite. Two hormones. Leptin is that sensation of feeling full, and ghrelin is the hormone that makes you feel hungry. So when you're constantly sleep deprived, ghrelin is actually more active and increased, causing you to feel more hungry throughout the course of the day in the evening. So you're consuming those more calories, whereas leptin is the hormone that it makes you feel full. So again, you're shortchanging yourself in your sleep. You're eating more calories. Think about that. That's what, like 1,200, what do you say? It was 300 calories over the course. Yeah. So 2,100 calories over the course of a week, and you're wondering why, how come I can't get rid of any of the weight,
Yeah, exactly. Like 3,000 calories a pound, right? Yeah. So at that rate, you're going to be gaining, like every 10 days, you're going to be gaining a pound if you're not sleeping properly, which is crazy.
Yeah. No, it's very interesting. And the more you dive into it, and I find the more you start to prioritize certain things, one almost helps support the other. Like you said, the exercise will help support sleep. You wake up the next morning feeling refreshed, you're going to eat healthy because you kind of want to repeat that. But alternatively as well, I found it's the opposite. You can fall off. Like I try to go to the gym at least 3-4 times a week to maintain this kind of mediocre average body. But I find it's very cyclical. When I've been into the gym 3 or 4 times a week, I'm just from a cognitive perspective, I'm a lot far sharper. I've slept better that night, which is helping obviously with that cognitive performance. I'm eating healthier because I'm aware of what's going in my body because I'm trying to do some good work here to make my overall performance better. But sometimes you fall off for a week or two, you go on vacation, these types of things. And all of a sudden I'm eating cheeseburgers again when I shouldn't, I know it. And those are the times when you should be eating your healthiest, when you're active at the gym. But I find it's almost the opposite, So yeah, it's an interesting kind of way how everything is kind of interconnected.
Yeah, 100%. The other things I wanted to add, and I want to hear your thoughts about this, is I read all these things about the connection of sleep and inflammation, right? There's now all of this data essentially showing that people who have significant sleep deprivation and insomnia, they have significantly higher circadian levels of inflammatory markers such as CRP, C-reactive protein, IL-6, TNF-alpha. I mean, for people who are familiar with these kind of terms, I mean, these are essentially the underlying pathophysiology of atherosclerosis and plaque. And when you have bad inflammation, then that would kind of lead into a lot of issues. Is that something that you ever see in your practice of people who have kind of inflammatory conditions? And let's say if they get diagnosed with sleep apnea, that it would affect their inflammatory disease?
I can't really, I don't want to speak outside of my scope is here as well. So I should obviously default back to you on this. Our process at Sleep Efficiency is to offer home-based sleep testing solutions. We don't really get a big medical history on them. When the referral's sent over, we have kind of the basics. So when you send patients over to us and we've sent the report back to you, I think you'd probably be in a better position to kind of expand on that because we offer the test. We offer a post-test analysis to discuss the details of the test, and we go into basically the sleep disorder breathing piece, and we'll touch on different things that we've already spoken about. But I'd maybe ask you to expand and educate me a little bit more on that.
So, I mean, it all goes back to the deep sleep, right? As we talked about. So, I mean, REM, as you pointed out, REM is really about emotional regulation and mental health, right? So a lot of it is about giving you emotional resilience, allowing you to work on your memory and really help consolidate your memory from whatever has happened during the day. You're learning all of that. Non-REM sleep and deep sleep is mostly physiologic. So when we talk about, as you talked about, kind of reducing blood pressure, reducing heart rate, cortisol coming down, all of that happens during deep sleep. So that anti-inflammatory effects of sleep generally happens during the deep phase of sleep,
right,
where your inflammatory markers drop.
So because we only see the patients for the actual diagnostic piece and we don't really follow up with them afterwards, other than just the post-test analysis, everything is kind of defaulted back to the family physician or the cardiologist or the referral source. I'll ask you this question. How many, after CPAP therapy has been implemented, we can talk about that a little bit as well, because a lot of the patients that you've sent to us, we've diagnosed, and it's been game changers for people to come through your longevity clinic. So talk about now that we've implemented a therapy a month later, 2 months later, or even what's the timeline associated with noticing some of those changes that you're talking about? Because again, we don't get to see any of that.
I don't know if you recall, but the first patient that I sent to you actually through the longevity clinic was this gentleman that was overweight and had resistant hypertension, right? So
I know who you're talking about, but no names.
Yeah, exactly. Early 40s, right? Yeah. Overweight, but had hypertension. And essentially, and the other thing for him, kind of going back to the emotional and mental health, he has significant attention deficit and just lack of energy. Very successful entrepreneur, but just lack of energy. And it was incredible, right? Like you remember, for him, it was life-changing. He went on it, first of all, within a week, his blood pressure normalized, which is quite spectacular.
Amazing. So expand on that. What would be, within a week is spectacular. So what would be a normal duration? And I suspect the more severe they were, the faster they're responding to the therapy, the faster that all the other checks and balances start to come into play. But a week was basically, would that be one of the fastest that you've seen?
Yeah, so I think a lot of that goes back to whether they have any other causes or etiology that could be contributing to their hypertension, to their high blood pressure, right? So if somebody has a genetic component, if they're also massively overweight and inactive, which we know are risk factors for hypertension, if their hypertension is essentially multifactorial, then sleep apnea would help, but it wouldn't resolve the high blood pressure. The amazing thing about this guy was that this is a young person who doesn't really have any other risk factors for developing high blood pressure. So for him, really sleep apnea was causative. It was the sole reason why he had a high blood pressure, and his sleep apnea, as you pointed out, was quite severe, right? I think if you remember, he had like 9 events an hour in that range. So yeah, the severity of sleep apnea and whether they have any other factors that could be contributing to their hypertension is what determines how fast they respond to therapy with regards to lowering of their blood pressure.
It's remarkable to me because, when I go to the gym, and I've spoken to some of the trainers, and do you guys talk to your clients about sleep, the importance of sleep? And you've got somebody in there who's clearly on a weight loss program. They've probably been struggling with weight for a long or a significant portion of time, and they're trying their best to do everything they possibly can. Maybe they're eating right, they're coming to the gym 3 or 4 times a week. But being in this field now for 20 years, there's almost even a look that they have in their eye when you can tell when they're apneic. They're puffy, they're vacant, they're glazed over a little bit. And of course, overweight is a big kind of marker for sleep apnea patients. And nobody's asked them about any questions about their sleep. And there's so many people that could potentially champion those moments. So you get somebody who's coming in 3-4 times a week. They're doing their exercises, but they go home that night and they go to sleep at night and they stop breathing 70-80 times an hour. To give an analogy here, it's like when you plug your phone in at night, you've got you woke up in the morning, you've got 100% battery power, right? You can do 1,000 emails, you can check your socials, you can order pizza, whatever you want to do. You go back in at night, you plug that phone, you got 100% again. These people who are severe apneics, when they go to sleep at night and they plug in their internal battery, which is their sleep that gives them that battery charge, when they wake up in the morning, even though they may have had 7, 8, 9 hours worth of sleep, it's like their internal battery is starting at 50%.
100%.
So now they get to 2, 3 o'clock in the afternoon and they're exhausted already because they only started off with 50. How do you expect that person to be able to go to the gym and continue the programs that they want to do? And the will is there, but through no fault of their own, through this physiological process and these sleep disorders that are occurring, specifically apnea in this case, they're not going to be successful, right? So, creating awareness, I think what we're doing here today is fantastic. I was on the news this morning talking about sleep and everything we're doing. I think that it's people like us that are, and people in our community and our network that we know, a lot of the same people who are really starting to, shine spotlights in these areas that really need to be addressed.
One thing I want to quickly talk about, because you kind of pointed it out, and I think it would be interesting for a lot of listeners, is melatonin, right? So you talked about the importance of melatonin, how melatonin is produced naturally in your body and it kind of regulating your circadian rhythm, right? Like it's essentially regulating your sleep and waking rhythm. Can you talk a little bit about first your endogenous, your natural melatonin that's produced in your body, how that affects the circadian rhythm? And then maybe we can kind of discuss a little bit about just the beneficial effects of melatonin, and then maybe we can go into supplementation for melatonin. What your thoughts are on that?
Yeah, so like you said, there's endogenous and then exogenous forms, and melatonin is it's created in the pineal gland, and it's known as our sleeping hormone, or our dark hormone that creates and promotes sleep and allows us to feel sleepy. And it starts and it's suppressed by light. So when we get up in the morning, exposing yourself to as much light will suppress melatonin. And it starts to release again, usually in the afternoon for the first time. We're usually around that 1 or 2 o'clock in the afternoon. If you have a well-balanced circadian rhythm, if you're going to bed at the same time, getting up at the same time, which is absolutely crucial as well. We didn't mention that in the sleep hygiene piece, but we can bring that back in. But it's built up, and it's crucial for people to have a balanced circadian rhythm, where some people are constantly shifting their bedtime and their rise time, and there's no continuity there. So those sleep cycles can't be tailored. The melatonin production is potentially not in place at the appropriate time. They can cause create what they call sleep phase delay syndrome. So they're staying up much later in the evenings, not able to fall asleep until 2 or 3 o'clock in the morning. And shocking, they've got a 40-inch flat screen in their bedroom that's just booming out light that's suppressing that, which is just absolutely awful. So melatonin, again, is key and is produced naturally. There is no substitute for a natural night's sleep. And if we look to exogenous forms, over-the-counter melatonin, these should be just used in very significant circumstances, very special circumstances. So if these people are suffering from a life stressor, perhaps, maybe there's been a death in the family, maybe there's a job loss, then a very short period of time to allow yourself to fall asleep. But it shouldn't be used on an ongoing basis. It's really a blunt instrument. I can render you unconscious right now by clubbing you over the head. It doesn't mean that you're going to have a good quality sleep, right? Melatonin kind of brings you to the starting line, but it doesn't actually help your sleep quality throughout the course of the night. That's a pretty good takeaway there. So even though if you've gone to like over-the-counter doses, obviously the longer they take it, your body's just going to build up a tolerance, and it's getting to the point where you become dependent on it. But you know what? The normal doses, just like THC or CBD, if you rely on something as a staple and a crutch to fall asleep every single night, the doses are going to increase, and ultimately, it's going to go up and up and up. And then you have to ask yourself what's being affected, what other part of your sleep is being affected if you're kind of doing an artificial sleep here or inducing something. So, yeah.
So what you're saying is interesting, because that's essentially what I recommend to the clients, right? That they only use melatonin sparingly. I only recommend it for jet lag, right? Like that's primarily when I recommend it to people when they're trying to basically readjust their circadian rhythm and trying to stick to the lowest possible dose, because the exogenous doses, what you take in a pill, is much, much bigger doses compared to what your body's producing. Would you agree with that?
Absolutely. And I find it, there's not a lot of education on it that the public would readily grab and look at closely. So much so that I have friends that are handing it off to their kids. Like
that's crazy.
Yeah, I have buddies of mine, and I've sometimes I'll play a video game in the evening, and we're mic'd in like we are now, and I can hear, one of the little guys come back to his dad and say, "Yeah, it's been 50 minutes. I haven't been able to fall asleep." And he'll say, "Go have melatonin."
Oh my God.
The kid's like 13, 14.
Oh,
you know what I mean?
Crazy.
And it's like Band-Aid fix.
Yeah.
You need to do absolutely everything else first before you start looking at that as the option. Whether everybody's so quick to just find a supplement or find the fastest fix to be able to solve the problem. Whereas, maybe the kid hasn't fallen asleep in 50 minutes because he's been on the phone for the last 50 minutes. Yeah. Get that out of the bedroom. Maybe you got to look at his diet and his nutrition. Maybe you need to look at a variety of other things. Again, we live in an on-demand society now, where if we don't get the result that we want right away, we'd much rather have a fix for it. And the melatonin piece, I know here it's a little bit more regulated, but in the United States, melatonin is actually listed as a dietary supplement, and there's no regulation around it. So some of the doses in the bottles, they found to have 400% more than what's been advertised. And in that same bottle, there was only 50% of what's advertised. So in one pill, you've got people, kids that are ending up in emergency rooms. Again, Health Canada's got a bit more of a stringent protocol around it and policy, but in the States, it's kind of a wild, wild west, and people are throwing these things around like they're candies.
What do you think is the right dose if somebody wants to supplement?
0.5, I would say, is
like
what
the smallest possible dose, essentially, that's
Yeah.
available for melatonin. So that's super important for people to know, right?
Yeah.
Because most of the available doses are like anywhere from 1 milligram all the way to 5, 10 milligram.
Yeah, that's crazy.
Yeah. So that's crazy for people to know. It's so important that you have to take absolutely the lowest possible dose of melatonin if you're going to supplement, and only use it sparingly, essentially, in extenuating circumstances, not on a regular basis.
Definitely not. No, definitely episodic or situational. And, if it calls for it, anything longer than I would say maybe a week or two, then you probably should be looking at some behavioral lifestyle changes. If you're somebody that has problems falling asleep, this might be a nice way to segue into some napping and the benefits of napping. Because if you're somebody that's having fallen asleep at night, naps are no. The first thing that you would get rid of is having that nap in the afternoon. So while it can be useful, maybe I'll ask you to speak to the cardiovascular component of the benefits of taking a nap. What we practice in our sleep world from a sleep perspective. If your sleep onset latency, that time it takes you to fall asleep, is longer than, let's say, 20 minutes, 25 minutes, and you're like, oh, I have a hard time. Well, you're napping for an hour or two in the afternoon. You need to get rid of that completely. You can't get a couple hours in the afternoon and then expect to have quality sleep in the evening. So while naps are a great tool to have in your toolbox, if there's any kind of indication of insomnia, problems falling asleep, staying asleep, the nap should be the first thing to go. But at the same time, the nap duration is very important to speak about, making sure that it's only maybe 20 to 30 minutes. A lot of people will fall asleep and nap for an hour, but what they've actually done is gotten to a deep stage of sleep and are in a sleep cycle they weren't able to finish. So now when they're ripped out of their slow wave sleep, they create something called sleep inertia, which is characterized by sleep drunkenness, a grogginess. Maybe you've had it, and I've had it before. You've gone for a nap and you've been out for an hour, and you wake up and you're like, geez, I actually feel worse than when I actually laid down. That's because your body's gone from a nice light stage 1 and 2, which can afford those symptomatic improvements. It can reduce stress levels, allows you to speak to the cardiovascular piece of that. But improve memory function, reduce anxiety and stress. But that's a 24 to 30 minute window. Anything over 30 minutes or maybe 40 minutes, and especially up to that hour mark, it's almost like purgatory. It's a space where you don't want to be. If you have the ability to do a 90-minute nap, I don't know, many people can nap for 90 minutes, you'd actually be able to go through all the sleep cycles, closing out with a REM period, and be able to, draw off all the different stages. So quick hit here, 20 to 30 minutes to be optimal. But anything after that, 45 minutes to an hour for a nap is where you don't want to be, because that sleep inertia will set in and you'll have maybe an hour or two before it lifts. It's like a fog, right? You're just walking around, you're like, wow, I've napped. Why am I feeling worse? And that's that sleep inertia gets in. So maybe you want to talk about the benefits of napping as it pertains to a cardiovascular perspective.
Yeah, so I agree. I basically tell clients when they ask me about it that if you want to take a nap, you take it before 3 p.m. and you make sure that it's not more than 30 minutes. Because once you go over 30 minutes, as you say, when you wake up, you're going to become more groggy. It's going to take your sleep pressure, your sleep inertia away for your night sleeping. So it's going to affect the quality of your sleep at night, which is much, much more important. Now, the other thing that I sometimes recommend to people, and I don't know if you have any experience with this, is NSDR, so non-sleep deep rest, or yoga nidra is the other name for it.
I'm not familiar, no.
So it's essentially similar. It's a technique similar to taking a nap, but it doesn't have any of the adverse effects of napping, and potentially it would actually provide a lot of the same recovery. So Matthew Walker, that you and I both really like, he talks about it. Andrew Huberman really talks a lot about it. He has kind of a sleep toolkit that's all about how to practice NSDR, and it's very easy to actually practice. There are YouTube videos. So sometimes I tell people, if naps make you groggy and you're tired during the day, maybe use NSDR, because that will give you some recovery, but without affecting your quality of sleep at night.
So this is kind of a combination combination of like breathing exercises and
It's like
meditation.
a deep meditation. Yeah.
Right.
It's like a
Gotcha.
deep meditation where you're almost like a half napping, but it's kind of essentially a deep meditation is the best way of putting it.
Yeah, I haven't looked into that, but that's interesting. I definitely will now that you've mentioned it.
Yeah, and kind of lowers your blood pressure, lowers your heart rate. So when people go into an SDR, their blood pressure and heart rate actually goes lower. So there's some evidence that maybe you would have cardiovascular benefit. But most importantly, the nice thing is because it doesn't take away your sleep inertia, it probably is not going to affect the quality of your sleep efficiency at night. So
Critical.
that's kind of a nice thing about
Very
it.
cool. Yeah.
Yeah. I mean, the melatonin piece, one thing that I wanted to mention, because people have asked this from me in the clinic is, you mentioned melatonin is useful as a part of the circadian rhythm. And melatonin actually has antioxidant properties, right? So a lot of people read about it. And because it has antioxidant properties, and antioxidant, as you know, is this big marketing scheme. There's a lot of food that have antioxidants, and antioxidants generally are considered to improve cardiovascular health.
You see that on the label and you grab it, right?
Exactly. Anything that has antioxidant you think is good for you because it's supposed to improve your cardiovascular health. So melatonin is supposed to be an antioxidant. So a lot of times people actually take it because they look at it as an antioxidant, and I'm going to take this thing and it's going to improve my cardiovascular health. But as we pointed out, because the dose is so much higher than your physiologic dose, your endogenous dose, ultimately what it's doing is that it has the opposite effect because it doesn't allow you to sleep properly when you're not taking it, right?
Exactly, yeah.
So that's kind of a massive issue with it.
For sure.
So that's great. So we talked about nap. One thing that I wanted to touch upon, because I get a lot of these patients, I don't know if you see them or not, it's women's health, different stages in women's life and how that affects your sleep. So maybe we can kind of discuss that a little bit. So tell me a little bit about that.
Before we even get into that, maybe talking just about sleep architecture in general, which is from male to females. Yeah, which is kind of this process that happens, right from essentially birth to when you're a senior. And because I've given lots of presentations to lots of different groups of people, kind of tailor towards. So sleep architecture is essentially, it's the amount of time you spend in each stage of sleep. So when we're young and we're teenagers, we're spending most of our time in that deep slow wave sleep because that's when our physical restoration is taking place. Growth hormone is released, muscle and tissue regeneration take place. So I've got two boys that are 16 and 14 at home, athletes. And when I've worked with the Ottawa Senators in the past, they sit in that slow wave sleep and they soak it up. Unfortunately, as we age, and this is for men and women, the amount of time that we spend in our deep sleep starts to shift. There's that shift in our sleep architecture. So we're spending less time in our deep sleep and more time in the later stages of sleep. So kind of a misconception that the older we get, the less sleep that we need. It's actually our ability to maintain it in large blocks becomes the issue, right? And for women specifically as well, let's say they're going through menopause or something like that. And this can be quite a long, drawn-out process, and their sleep suffers incredibly. Kind of a quick hit fact here that when you go to sleep at night, the temperature of your bedroom is actually critical to promote sleep, so that you can fall asleep quickly, and not just fall asleep quickly, but also maintain it as well. Your body's core temperature wants to drop anywhere from 1 to 2 degrees, and if it's unable to do that, you're going to have a very poor quality sleep throughout the course of the night. So speaking to the women piece with menopause and that being affecting millions and millions, anywhere, I guess, from the age of maybe 45 up to 55, it's something that they're dealing with on a night by night basis. So, making sure that bedroom is like that sleep sanctuary, whether it's cool sheets, making sure that the temperature, I think somewhere about between 65 to 68 degrees is kind of optimal, that will allow your body to fall asleep, because that internal temperature is rising, right? Your brain temperature and your internal temperature needs to be down at least 1.5, 2 degrees to get into that deep restorative sleep. And that usually happens during stage 2. So I maybe ask you to expand a little bit on that on the patients that you're coming through. Do you see a lot of them struggling with their sleep at night, specifically the women population?
Yeah, so it's huge. So you pointed out their perimenopause, right? So, I mean, women during their life, they go through all these different stages that affects their sleep really well. Like pregnancy is a very good example, right? And then perimenopause and menopause are probably the two big ones. As you pointed out, I think, the science, there's a lot of science around it, but I think a lot of it is temperature related with hot flashes, right? So when you're getting hot flashes at night, it's essentially not allowing your body's temperature to drop to the level that it needs to for you to be able to cycle through all of these different stages of sleep. And that's what's essentially disrupting their sleep, not allowing them to go into deep and REM nearly as well. So what I see a lot of perimenopausal women, by the way, because what happens around the time of perimenopause is all of these changes that happens in their body, right? They start having hot flashes. As a result of that, they get insomnia, right? Like they get all of these sleep disturbances. Now, as we've talked about today, once you have sleep disturbances, then that will completely disrupt the quality of your life. They don't have energy anymore. They're not exercising. At the same time, because of the hormonal changes that are happening, they also are gaining some weight. So that's also feeding into all of that, right? So they're more likely to have sleep apnea because now they've gained weight. On top of that, they're already not sleeping properly. So it's this vicious cycle of all these factors attacking them at the same time. And then their blood pressure is going up. That's just an estrogen withdrawal effect that happens at the time of perimenopause. But then it also gets exacerbated by the fact that they're not sleeping. So their blood pressures are going through the roof. They have all these changes in their metabolism, right? So the metabolism slows down. Usually they start developing problems in their lipid profile, right? So usually the LDL cholesterol goes up. Potentially their triglyceride is now going up because now they're developing almost like metabolic syndrome because their cortisol is high and they're not sleeping properly. So they're getting attacked from all these directions that is really going to affect their longevity. So sleep is a huge piece for them, right? Because if they're having hot flashes, and if they're having insomnia, which you've seen a lot of perimenopausal women, one of the things that I first attack with them and try and treat is really their sleep. Because once you get their sleep sorted out, by putting them on something, whether it's HRT, hormone replacement therapy, or specific drugs to control the hot flashes, then all of a sudden they're going to sleep much, much better. HRT has got a lot of bad press, hormone replacement therapy, because of slightly increased risk of cancer, particularly breast cancer. So for a long time, all the practitioners of medicine, particularly family doctors, stopped prescribing HRT. But now we know that if you're not sleeping properly, that's probably one of the main indications to actually give people HRT. If you're having a ton of hot flashes, it's disrupting your sleep and you're tired during the day, you're having brain fog, that's probably a very good indication to go on HRT. Do you see a lot of patients that are on like perimenopausal that are on HRT?
No, again, we get referrals, and I shouldn't say no. I don't know, right? Again, we're kind of that diagnostic piece. Just like if you're going to a hospital to a sleep lab, they'd actually have more medical record on you, but often it's just a quick referral sheet. Some doctors will offer a little bit more information and a little bit more history, but most of the time it's just like symptom. Please assess for obstructive sleep apnea, or if we're looking at insomnia. The nice thing about some of our tests now that we're utilizing. As the technology advances, so does our healthcare, right? So once upon a time, and you still do, the sleep lab is kind of a gold standard. Now we've got tests that are able to measure, not just our apnea-hypopnea index, our respiratory disturbance index. We're looking at the different sleep stages that we're achieving at nighttime, how many times we're waking up throughout the course of the night. Actually, in some of our tests now are being able to screen for AFib as well, which might be interesting to you, and we can have a conversation about that offline. But yeah, it's giving a much better snapshot, and that's where I think we need to go ultimately. There's a lot of testing that can be done outside of the hospitals. You're doing things at the longevity clinic. Maybe you can take an opportunity to, tell me a little bit more about. So I know when I've got patients that are coming your way, a little bit more in depth in the longevity program and exactly the different components that make up that whole cardiac care map.
Yeah, so sleep is a big piece of it, but essentially the program is divided into three main components, right? So we have the metabolic piece to it, which is essentially a full blood work metabolic panel in combination with their body composition analysis to look at their visceral fat and look at their lean muscle mass, particularly the muscle mass in their arms and legs, because that's an important metabolic marker. Yeah, so there is that piece, which is essentially the metabolic piece. Then the second piece is the cardiovascular piece. So we do a full cardiovascular workup on the clients.
Expand on that a little bit. What kind of tests are they doing for their cardiovascular? So echocardiograms, Holter monitor, stress testing, these types of things.
So we do a stress test essentially to look for blockage in the arteries. We do an echocardiogram for a comprehensive structural assessment of the heart. We do carotid Dopplers to look at plaque in your carotid arteries, which are feeding your brain to essentially assess your risk of stroke. So we kind of re-stratify you for heart attack and stroke through the cardiovascular workup. We do the metabolic screening through the body composition with the DEXA and blood work. And then we have the lifestyle piece. And the lifestyle piece is a combination of a fitness assessment where we look at all of your fitness metrics. So we look at your VO2 max, we look at your strength, we look at your power, we look at your stability, we look at your mobility. So it's a pretty comprehensive program to see where you're at with regards to your fitness and exercise regimen. Then we have a nutrition piece. So we have a dietitian that works with you to optimize your nutrition for longevity. And then there's a mental health piece and there's a sleep piece.
How long? So let's say I want to, sign up for the longevity program. What's the duration of the program from, let's say, start to finish? Is this a month program? Is it a 2-month program? Is it 3? Is it ongoing? Talk about the, how many touch points is it? Is it a high touch process at the beginning and then, the follow through at the back end? Explain a little bit more about that.
Yeah, exactly. So we have about 4 touch points at the very beginning that happens in kind of a span of a 4 to 6 weeks time window to get all of this workup done. So from the lifestyle to metabolic to cardiovascular, you get all these investigations done within that kind of 4 touch points within the first 6 weeks. And then we give you a comprehensive picture. After that, you meet with me. I kind of put it all together for you to give you a pretty good sense of where you're at metabolically, cardiovascularly, and with regards to all these lifestyle pieces. And then after that, you can either sign up to our longitudinal program to kind of try and optimize whatever we found that you're having deficiency in, or you can come back for a 6-month follow-up or a 1-year follow-up when we do essentially a shorter version, a summarized version of what we did at the beginning, mostly focusing on areas that you had deficiency before and essentially holding you accountable and helping you optimize it.
That was going to be my question. So how many people relapse, if you will, or how many people go back to their old habits after they've come through and, they've made some proper changes? I know in our world for CPAP compliance, it's only about 50% long-term.
Oh,
right?
That's crazy.
Yeah. It's not a good, it is the most effective therapy. So I was going to ask we have people come in and they're like, yes, I know I'm severe. You give them all the information, but we're also creatures of habit. And it's easy to do the wrong thing sometimes, right? It's the easier approach is to, bury your head in the sand and just hope that everything just kind of stays the same or doesn't get any worse ultimately. So, maybe that consistent follow through, I guess, is what I was getting to there. You said you had kind of a follow program or a longitudinal program where you're maybe bring them back every 6 months, every year. Do you find that once you've shined a spotlight on those particular patients, are the changes long lasting? Or do you find when you've maybe done a follow-up 6 months later, have they kind of gone back, or is it a bit of everything? I guess how much, when you give them a peek behind the curtain and put that magnifying glass on their different areas of their health, are they incredibly responsive, to the point where it's like a fear tactic now? Or, do they, I guess you can just take over from there. What's the kind of the standard here? Do you feel like you've made a change that's going to last? And can you even tell maybe just on who the patient is?
Yeah, so I think it varies a lot from patient by patient. But I think as soon as they see a little bit of a difference on how much better they feel, then all of a sudden that's a game changer. Because people just intuitively are not very good in following long-term recommendations that affects them 50 years from now. So, if they're 40 years old and you're telling them, okay, instead of living 80 years, you're going to live 90 years, that's not a very tangible outcome for most people. They can't really put a value to that.
This could be like a smoker or something like that,
exactly,
right?
Exactly. It's like I'm enjoying this cigarette right now. I don't care what happens in 40 years.
Yeah, the last 10 years are the worst years of my life anyways, right? It's that kind of mentality, yeah.
Exactly. But one of the things that we constantly talk to patients about is it's as much about their quality of life as it is about the quantity of life. If I'm going to teach you how to lift, how to get stronger, how to get more stable, you'll be able to have more energy and move with more ease around the world. If I help you lose weight by 20, 30 pounds, when you're going up 2 flights of stairs, you're not nearly as short of breath. You're playing with your, 10, 12-year-old kids. You can keep up with them for an hour. Those are tangible outcomes that a lot of people would respond to a lot better. So that's really what we emphasize, is really about optimizing your performance on a day-to-day, allowing you to enjoy things that you like to do. That's awesome. That's the number one goal.
Yeah.
If you're sleeping better, right? Changes your life. Your productivity goes up. You have more energy to exercise, more energy to spend with your loved ones. That has an immediate impact, right? And then people would stick to the program because they see that immediate result.
I remember when I was working sleep lab and straight overnights, we'd have, because I used to do CPAP titration studies. So these are people that have been diagnosed with severe sleep apnea. Now they come back to try the CPAP on for the night. And they've been busted for so long, and they may not even realize it because their baseline, they wake up every morning and that's just how they feel, right? So they don't know how much of an improvement can be made by splinting that upper airway, achieving those stages of sleep. So you have somebody that came in, and we used to get them regularly. And I remember this specific type of person and specific people in general where, they maybe stop breathing 70 or 80 times per hour, and they come in for their CPAP, and they, of course they're reluctant. And in that particular situation, they're in a hospital bed. They've got all the wires attached to their cameras and overhead pages. So their perception of how the night is going to go is immediately negative. They don't want to be there. But inevitably we get the mask on them, and we start the titration process where we start ramping up their pressure as the respiratory events start occurring, and we get to that sweet spot. So let's say it's a pressure of 9 centimeters of water that's keeping their upper airway open. And now, and this shows you how much our body is reliant on certain stages of sleep, because these people that have been so severe, they've been unable to achieve their REM sleep, or maybe they're just getting snippets of it, maybe 30 seconds, and then that respiratory event kicks them out. Now they have a splinted airway. They're able to get to the REM sleep, and in our world we call them REM rebounders. So their body's been deprived of this stage for so long, 5 years, 10 years, not getting enough. They get to that stage of sleep, and all of a sudden their body goes, "What the hell is this?" And they stay in the REM sleep, and they sit there and they soak it and they soak it. They may come out briefly, but instead of progressing through that sleep stage of 90 minutes, they go right back into REM again, because their body goes, "Hell yeah, this is something that I've been wanting for a long time."
Well, that's crazy.
And I'd have these patients come out, even though they've slept on a crappy bed for the night, they've got 1,000 wires attached to them, and they've tried CPAP machine, a mask on for the first time. I've had some of them were almost in tears, and they'd say, "I don't know what the hell just happened. That was one of the best night's sleep I've ever had." And because their body has just been craving it for so long, and they don't know. And I think it's important to state here that we have to get away from this preconceived notion that apnea is just a heavy person problem. It can be with the tongue, the tonsils, or the uvula. I've had patients, sports athletes that I've worked with, people that could be right off a magazine, a GQ magazine for Men's Health. I've had these people in my office and done tests on them where their apnea-apopnea is in the severe range because of that enlarged tongue, tonsils, or uvula. So, once upon a time, it was thought to be just a heavy person problem. I've had patients that are 300 pounds with no problems breathing, and I've had patients that have been 120 and been some of the worst I've ever seen.
That's awesome. It's crazy. REM sleep is quite incredible, right? Like when I don't get REM, because I track my sleep all the time, for whatever reason, if I've drank, for example, right, like gone with the boys, had a couple of drinks, that night you usually don't get REM. You feel it next day, right? Like
Absolutely.
Emotionally, you're just on the edge, you're just constantly feeling on the edge. It's incredible. Even one night of poor REM sleep, if you're not getting that an hour and a half of REM a night, it definitely affects you. It's quite incredible.
I've had the exact same situation, and I wake up that morning, I'm like, I can't actually wait to go back to bed tonight and just not be in this state that day, because it's impacted my ability to overreact with my kids or something like that. You just don't want to be bothered. That emotional regulation that you were talking about, it's so critical. And again, you may get a little bit of the REM sleep at the last few hours, last couple of hours, but you haven't had nearly enough of it. And it's so critical for how you are going to be responding to every aspect of that day. And, if you've got things that you need to be accountable for the next day, how is that fair to everybody else around you?
Yeah.
Now you're just this emotionally charged, overreacting parent or significant other. We started to work in it with a couple of different businesses. And if you work for a company of, let's say, 500 people, and the lowest guy in the totem pole is constantly sleep deprived, or, is having alcohol and not getting quality sleep, you may not really notice that one particular person if they're part of a large group. You look at that CEO at the head of the company, and if that person is consistently sleep deprived and he's now managing a team of 500, his constant sleep deprivation is going to have a massive impact that's going to ripple all throughout the organization. So, I think that's a completely different story as well, but making sure that, the leaders of everybody, but especially the people that are in leadership roles, how you sleep at night can impact your entire organization, not just from making smart decisions for the company, but who you are as a person with your staff, your charisma, your ability to be a solid leader. Or are you going to come in and constantly be miserable? That's going to trickle down into a horrible workplace. It's so critical. I don't know how much time we got going on here.
We're over.
Oh, are we? Okay.
Yeah. So let's finish by quickly talking about a quick key message from our dear sleep specialist as to what's the key take-home message. Actually, before we talk about the key home message, do you want to quickly say when people should be concerned that they might have a sleep disorder breathing, a sleep issue, and they should seek medical help?
Yeah, so we've talked a little bit about sleep hygiene, and on our website, sleepefficiency.ca, there are lots of sleep tips. We do blog posts. All my media posts are there for CTV News. So if you have literally incorporated every best sleep practice you can, and that's from, as we talked about, exposing yourself to light, watching your caffeine, reducing your alcohol, going to bed at the same time, getting up at the same time, continuity is king. If you're somebody that's done all of these things, despite your best efforts, and you're still waking up tired, I think that would probably be, you have to listen to your body. You can't just rely on your doctor to refer you, because ultimately the family physicians, they've got too much on their plate. They don't really know an awful lot about sleep. I would say listen to your body. If you're constantly getting 7 or 8 hours or 9 hours sleep every single night and you're still waking up unrefreshed, I would say it's probably time to activate a sleep test. So the way that people are able to do that is to find us at sleepefficiency.ca. Patients can actually self-refer. We have 200 doctors that are referring to us, but because we're able to see the patient without the referral, we have a home-based sleep testing solution. We're actually shipping these devices right across the country and the province. We get the test done in the comfort of their own bed. We have a respirologist who reviews all the results. Results go back to the patient and the family physician if there happens to be one in place. But yeah, I would say, if the main takeaway here is you can easily rule something in or out. So instead of wondering and hypothesizing and thinking maybe it's an issue, by this time next week, let's say if we're having a conversation about your sleep now, by this time next week we'd already talking about a solution. Be proactive, and lots of colleagues that we both know, they'll always say prevention versus prescription. What can we do today so that we're not, slapping ourselves with more melatonin as an example for, or a medication of some sort, when really the sleep quality should be looked at first. And then from there, we can build off of what we need to do. Because as you said, Matt Walker, I think one of my favorite quotes, I guess he said, sleep has been looked upon as the third pillar of health alongside nutrition and exercise. But he would push it one step further and say it's actually the foundation on which the other two pillars will sit. And that stuck with me, and I steal that regularly, but I think it frames it quite nice.
Yeah, so I agree. So one thing that I would say is you should never think about sleep as a luxury, right? Like it's a necessity, particularly when it comes to heart health. And as you said, as a foundation of a longevity program, right? So if you're not sleeping properly, then that means you're not dieting properly. That means you're not exercising properly. And ultimately, your cardiovascular health cannot be optimized if you're not sleeping properly. So
the longer you sleep, the longer your life. It's pretty simple, straightforward.
Yeah, that's awesome. That's
okay.
awesome. I think we're good.
Yeah, sweet.